Cuba is a really interesting place because it's a country in the global south, but their health outcomes like life expectancy are the same as countries in the global north, but at a fraction of what it costs us to have those same health outcomes. So Cuba is a place that you can learn a lot about ways that we can actually build health equity and ensure that everyone has the right to health. I want to build more research connections in Cuba because Cuba has, again, really interesting policies around ways that we can actually ensure the right to health for all. And so Cuba has so much to teach all countries about ways that we can strengthen our own universal healthcare system and ways that we can reduce barriers, ways that we can create a stronger social security care for everyone. Cuban healthcare system is all based around preventative care. The social determinants of health are being taken care of everywhere, and that's visible. Everything is integrated. Another thing is really the deep, deep sense of care that you feel in all of their social systems. In Cuba, although they have a very difficult economic situation because of the US blockade, the state has not retreated from funding life, from funding health, education, housing, even though they are in very difficult economic times. And so that idea that everyone should have the things we need to live is so apparent in Cuba and done in a way that is so deeply steeped in solidarity, in care. Amazing to be able to see firsthand and watch the students go through that learning as well. So a lot of my research has been with host families that welcome students, like our students here at York, into their homes, to learn alongside them, to care for them. And one of the biggest things that students really need to deeply understand and live is that this is a reciprocal relationship, that hosts who are welcoming you in their own spaces are also part of the experience. And so when we think about and build these kinds of experiences, both students and hosts need to be taken into account of what their needs are and what that's going to look like in community. So it was such a gift for me as a professor to be able to witness the transformative learning that happened for students. Cuba is a very unique place. It's an outlier in many ways in terms of their economic system, in terms of the revolutionary history, in terms of the ways that they've built their society outside of capitalism. And to be able to be steeped in that, to live with families who were talking about that daily, to get to go into clinics and consultorios, which are little doctor-nurse, was very transformative for students. And so I think each student, based on their own social location, is walking away with some different learning, but very deep learning because they were in this space, deeply engaged in community, learning from people who were very different and very welcoming and open to teaching them about their systems and ways they set up their society, policies, and healthcare.